Respected chairpersons, dignitaries, seniors, dear friends, ladies and gentlemen, very good morning to all. At the outset, I am thankful to the organizer committee of OCUCON 2023 for giving me the opportunity to present paper in this prestigious conference OCUCON. I am Dr. Amala Sankar Chatterjee, Senior Registrar and Doctor in Charge, Occupational Health, Tata Steel Hospital, Noamundi. Today I am going to present on screening for COVID-19 among workers attending medical examinations under Occupational Health Service of an open cast iron mine in Jharkhand, a cross-sectional study. I have no conflict of interest to declare. This is my topic. To introduce, safe and healthy workplaces are an integral part of occupational health, and unsafe work practices anywhere are a constant threat for both of our health and also sustainable business of an organization. Employers have the overall responsibility to ensure all necessary preventive and protective measures to minimize occupational risks to workers at workplace. For last 2 to 3 years, the world was overwhelmed with the pandemic disease caused by novel coronavirus, which emerged in Wuhan, China in December 2019. And in the context of a pandemic, during which many people may be infected but asymptomatic, diagnostic resources towards those who do not exhibit warning signs of infection is very crucial. Health workers are responsible for following established rules of the protection of their health and safety at work, especially in the context of COVID-19. According to the scientific literature, healthcare workers have the highest risk of occupations due to the nature of their work. Screening involves testing asymptomatic individuals who do not have known or suspected exposure to COVID-19 in order to make individual decision based on the test result, and there was no screening strategy to exclude anyone contagious entering the workplace, and workplace-based testing for SARS-CoV-2 could identify workers with COVID-2 infection and thus prevent to reduce further transmission. Our objectives was as a part of screening to find the spectrum of COVID-19 cases in workers of an open cast iron mine in Jharkhand, to study the epidemiological profile and prevent the reduced further transmission, and to provide recommendations for prevention of spread of COVID-19 among the mining workers. Methodology, it was a cross-sectional study. 860 mining workers were there who appeared for the medical examination under initial or periodical medical examination, IME or PME. Study period is very important. It was in the early phase, last phase of stage 1 or early phase of stage 2 of the COVID in our area, that is 14 December 2022, 30th April 2021. All were given general pro forma and the answers noted. Screening for COVID-19 by rapid antigen test, RAT, a TrueNAT test, RT-PCR in our setup. Chi-square test was used for statistical analysis. Formal consent was taken from each worker and from the HR department also. The pro forma was used to collect information on travel history, development of any symptoms related to COVID, whether concerned persons have any history of contact or any positive case, vaccination status if there is a schedule, or status of quarantine if any. Observation and discussion. As per the study of 860 people, mean age group of the employee was 32.09 plus minus 8.42, and mostly in the age group of 21 to 30, that is 54%, and there was very less number in the age group of 51 to 60, that is only 4%. 82% were male as per the study. So for educational qualification is concerned, 47% were in the category below matriculation up to class 9, and 45% above class 10 to class 12. 63% were married as per the study, and as per capita income, 41% were in the 5,001 to 10,000 group, and the study revealed that 44% were smokers or history of smokeless tobacco, and 31% addicted to alcohol. So for the categories concerned, company employee and contract employee, it was only 15% was the company employee who was on payroll. 85% were the contract employee, because initial medical examination mostly occur in the contract employee, and also they are in the less age group, 21 to 30 age group was the more. Study revealed that only 3%, that is number is 28, was COVID positive. Among the COVID positive cases, most of them were in the age group of 21 to 30, which I already told 57%, and there was not a single case in the age group of 51 to 60. And COVID positive cases, there are 89% are male, 11% female. Most important is that among the symptoms, among the positive COVID positive cases, symptomatic was only 36%. 64% were asymptomatic as per our study, and who were developed the symptoms mostly developed with the generalized weakness, that is among the 50% workers. And rest 20% had history of fever, another 20% of cough, and 10% had history of sore throat. Use the chi-square test, association between COVID-19, these charts and diagram, if you show COVID positive cases, only 5% persons has generalized weakness, and no weakness was in 23%. And for COVID negative cases, it was 41 and 791 respectively. So generalized weakness showed statistically significant association with COVID positive cases. So far history of travel is concerned, 32% had history of travel, interstate travel, and rest 68% had no history. This was the proforma, which I already mentioned. It was used before the clinical examination, before screening, for screening test purpose, questionnaires, and also some proforma. So summarize, the study revealed mean age of the employee was 32.09 plus minus 8.42, maximum in the age group of 21 to 30, that is 54%, and 82% were male. As per the study, 44% were smoker, 31% had history of alcohol. 28 workers, that is 3%, were COVID positive, and mostly asymptomatic, 64%. Among COVID positive cases, 57% were in the age group of 21 to 30. Among the symptomatic cases, 50% had generalized weakness, 20% had history of fever, 20% cough, and 10% sore throat. Generalized weakness was significantly associated with COVID-19 positive cases. So I recommend workers must be aware of their health status before entering to the workplace to ensure safe and healthy workplace environment, especially at the time of pandemics like COVID-19, to identify all the high-risk cases or COVID positive cases. That means screening for all workers. More emphasis on testing, that is screening, before any medical examination, be it pre-employment or periodical or initial medical examination. Employers have a major role to conduct the same. More awareness session, shop floor classes, training programs on COVID-19 and its prevention using face masks, social or physical distancing, hand hygiene, etc. And more emphasis on vaccination program to motivate all the workers as per the guidelines. These are few pictures of our workplaces, awareness session and COVID screening, thermal scanning. So I conclude my session. Screening is important for keeping workplace safe, especially in the time of COVID-19. Worker screening is being used to limit further spread of COVID-19 following its recent emergence. Most of the affected persons were asymptomatic and would have been caused of more positive cases at workplace and community at a large. The findings of the study can support the evidence-based policy to combat the spread of COVID. It also emphasized the need of implementation of population-based screening programs at shop floors that prevent the spread of COVID-19 among the mining workers. These are my references. Thank you for patience.
Thanks a lot, Dr. Chatterjee. Yeah, maybe you have a question? Yeah.
Sir.
About any date, I think there was no date.
Sir?
Among the COVID patients.
Date? Death?
There was no case.
No, sir. It is screening program before the medical examination. So who has appeared, who has become the positive, we have already taken the COVID protocols, separated, isolated, and then RT-PCR test or as per the protocol. This is only the screening for before medical examination, initial or periodical medical examination. That was another setup, sir. We have treated almost 2,000 patients in our mining setup in different 3 waves. There was death. 12 deaths were there. In first wave, no death. In second wave, 2 deaths, 4 deaths, and few patients were referred. But it was managed well. But this study was only the screening before the medical examination who are appearing for periodic.
Okay.
Thank you, sir.
Okay, thank you, Dr. Chatterjee.
Thanks a lot.